Drop your right shoulder down just a bit.
Is that normal?
There it was.
What is... I would not want to get in a tickle fight with you.
Okay, so tell me a little bit about like the shoulder, your back, what you've been dealing with, how it's getting in the way of your day-to-day life, and really what you've been going through in general.
I've been dealing with this again for 1.5 years. It's caused so much pain. I'm not able to sleep at night. Just especially on my left side, it just feels like my chest is caving in. It feels like it's wrapping around to the back of my shoulder, and I just recently went to the ER for I thought I was having a heart attack just due to the pressure. As far as my sciatica, I could be sitting down for maybe 15 minutes, so I'm not able to sit for long periods of time before my leg starts to go numb, and it tingles down into my toes. I'm constantly trying to adjust on my own, trying to pop my neck. I don't know if that's good, but it's just what I find for temporary relief.
Okay. And you've seen physicians for this, so you've seen medical doctors, and their advice was what?
Oh yeah, definitely. So I've seen multiple chiropractors. I spent hundreds of dollars trying to figure out, you know, if they could fix me. Also, I've seen, I went to the ER, and then I went to see my primary care doctor, which she told me that it was so inflamed that I should be taking 800 milligram ibuprofen to help the swelling on my chest.
And was that a temporary time, or did she want you taking that like consistently?
I went to taking it consistently. And I personally don't like taking medication, so I definitely want to look at getting something that will be able to cure it without medicine.
Right. A lot of people don't realize this, but about 16 to 17,000 people die every year from NSAIDs. So it can have harmful effects on the kidneys and the gastrointestinal tract as well. So while it can be a godsend in the short term, what we don't want is people to be reliant on these medications in the long term, because there's some serious effects that can come from that. So that's where conservative therapy like physical therapy, massage, acupuncture, and chiropractic can be very useful for people. Anything else you're limited? Like, can you do physical activities like running, push-ups, or any of those things limited at all?
I'm not able to run for long periods of time just due to the stress I feel on my chest, and then I have to do a ton of push-ups since I'm in the military, and when I start to go down, it just causes so much pain. I kind of just flop on the floor.
Weakness too?
Yes, definitely.
And have you had any like anxiety attacks or panic attacks associated with this?
I have actually. They diagnosed me at the ER with anxiety, just because they thought that that's what it was. They gave me x-rays, I checked on my heart to make sure that everything was performing the way it should be, but it was just due to the rib being elevated.
And they give you a prescription for that also?
Yes.
Yeah. Are you still taking that, or?
I take it occasionally, just when I feel the pressure. Like I said, it kind of feels like a heart attack, so I just, you know, take half of one because I'm super sensitive. So
let's check your muscle strength in the arms here.
Sure.
So I'm going to have you put both hands like this for me. I want you to push this one out to the side. Any pain there?
In the shoulder and the back, yes.
How about weakness?
Yes.
Definitely. Okay, try that side. Yeah, so a big difference there. Let's go same one. I'm going to push inward that way. How's that one? Is that one okay?
Yeah, that one's fine.
That one's better. Okay. So we're going to go to right here. Hold that thumb up. I'm going to push down. Try not to let me. That one's okay? And then there. Okay. Let's bring this arm to right here. Push down towards my face. That hurts?
Yeah.
Okay. And then I'm going to check this one too. So push down towards my face. So a lot stronger there, right?
Yeah.
Feel the difference? Okay. Let's go back to here one more time. And I want you to turn your head to the right all the way. And then push out again. Does that feel any stronger?
No. Now, yes.
Yeah. Turn your head to the left all the way. And push out. So that's weaker.
Yes.
Yeah. Okay. So look straight ahead. I'm going to push down right there. Does that shoot into the arm at all?
No.
Okay. And if I go to there?
No.
And if I go to there?
Yes.
That shoots?
Yes.
Okay. And how about if I push sort of in there?
No.
Not too bad? No. And the pain you have is sort of there?
Yes, and a little bit farther into the shoulder blade.
Okay. Like under almost?
Yes.
Okay. Let's try to do a couple push-ups.
Okay.
Can you go all the way down?
No.
All right, so this is Dr. Greg, and we're going to do a decompression adjustment on you. So this is going to create vertical space along your spine. It might feel a little bit intense.
Okay. Oh my gosh. Oh my gosh. What the heck? Oh my gosh.
Well, all right. So
I think
just breathe through that.
I'm sweaty.
Where'd you feel that?
Oh my gosh, that went all the way from the back of my neck to like, I don't even know what's in there behind your butt.
Like all the way down your tailbone?
Oh my gosh. I felt it more in my tailbone.
Yeah. Other way?
You get it?
I'll fix it on the other end. Thank you though.
Oh my gosh. Thank you.
That's a sore spot.
Yeah.
And so is that one.
Oh yeah.
And that one.
No, not that much. Ow.
Yeah, that one for sure.
Ow. Oh.
Okay, let's clear that edge. So we're gonna go right there. Drop your right shoulder down just a bit.
Freaking freak. Oh my gosh. Is that normal?
Yeah, that's normal.
Oh my god.
Less sore there.
Yeah.
Doesn't hurt as bad there?
No. Oh my god.
Okay, so we're gonna get the lower edge on the same area.
Yeah, that one hurts.
So we're gonna go right there.
Oh, my gosh. Dude. Oh my god. Feels amazing, but gee whiz. And that's normal?
Yeah. There we go. Less pressure than when I'm pressing now?
Yeah, it's
Yeah.
like it disappeared.
Yeah, the light.
Yeah.
There we go.
Oh my god.
Yeah. So if you swing around here, we can see part of why she's having the sciatica. We can see this leg length difference. So
From this angle, you can see her.
yeah, see how the shoe lineup here is. So this leg's basically longer. It's hitting the ground earlier than the other side, so that's jamming it. So we'll have to make a correction there.
Oh! Oh my gosh.
Almost. Okay, we'll bring this one right here, this one right here. So squeeze both legs together really hard. There it was.
Ow! Okay.
Feel that
Next.
pop?
Yep.
Find the pubic bone?
That's so dope. Oh my gosh.
There we go. That's really close. So
Dang.
pretty close. So once I correct the left hip, it should even out completely.
Is that why it hurts when I run?
Yeah, absolutely. So that leg being longer because of your pelvis, that foot's hitting the ground earlier and it's jamming that whole side.
Oh my gosh. Okay.
So we'll make the corrections there and we've got to change some of your rehab. But what we may end up having to do is having to put a lift in your right shoe.
What?
So like a heel insert.
Oh, okay.
So it would go into your shoe, so it would sort of even out the length.
Oh, okay.
So that way when you're running, you're not putting all this extra pressure on your hips.
Interesting.
Because
okay.
this is transferring upstream too. With your hip being so much higher on this side, it's going to make your spine curve like that and put more pressure on that side of your neck.
Oh my gosh, yeah. And it's literally all on my left
All on the
side.
left, yeah. Roll on your side facing towards me now. And then you're going to scoot all the way up this way. So you've had this one done before, right?
Mm-hmm.
Okay, so straighten this leg. So I'm going to go right there. And then this arm comes to there.
Oh! Oh my god! Oh my gosh! Oh my gosh.
Where'd you feel that
That
one?
felt so freaking
You
good.
needed that one?
Ah, yes. That shot like all the way down my leg.
Right, go
Felt-
on you.
Oh, that
Go on
was
your back.
awesome.
And then scoot back just a little bit. So scoot back that way just a tap. There we go. So let's look again here.
That honestly feels more even already.
Yeah. Pretty close. Yeah. I can live with that for now. Okay.
Ow! 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 Ah!
Woosah.
Oh, I give up.
Try to breathe through it. These are the techniques you guys learn in the military, right?
Yeah, you just pressure poke them and they pass out.
Exactly, basic training stuff. Give yourself a big hug there. So we're gonna place this adjusting tool right there. So arms a little tighter, like across your body more.
Oh.
There we go, perfect. I'm gonna roll you back over this. Deep breath and blow it out.
Oh my god.
You can relax your arms now.
I've seriously been trying to pop that for like months. Oh my gosh.
It's a lot better there. So go hand on the hip like this. And
Hand on your hip.
hand on your hip. Pull the elbow back.
What is... Oh my gosh.
So you feel that right on the top of the
Yes.
joint. So that's your AC joint. So we definitely need
That's
that
cool.
too. Feels better there? On
Yeah.
the joint?
Yes.
Yeah. Let's check the other side. I just want to see if there's anything there too. So pull back. Pull.
Oh my gosh.
And a little off too.
That is so cool.
So you've had those adjustments at the other chiropractors, yeah?
No, they've
No,
never
okay.
done that.
Alright. So let's take this hand and go in and out like that. So I'm gonna hook right there. And keep moving the hand.
Ow!
Keep going.
Ow!
Keep going.
It's tingling.
Down to your hand.
Yes.
That's
like,
a good thing.
oh my gosh.
'Cause if that's sort of what you've been feeling, that's usually where the nerve is trapped in the shoulder blade.
That's
area.
what it feels like in my leg.
Ah, that makes perfect sense.
Oh my gosh.
Keep going. Keep
Okay.
going. Try to move your arm and less of your elbow.
Okay.
There we go. Starting to fade out.
Yes.
Okay. Good. Alright, we're gonna go right here. This is your serratus anterior.
Ow.
There it is.
Ow! Okay.
And that's sort of where you get the chest pain.
Ah, yeah.
Feels like a rope.
Oh my
Wow.
gosh. Oh my gosh, oh my gosh. Ow. I would not want to get in a tickle fight with you. Oh my gosh. Oh my gosh. Ow.
Catch your breath there.
Why am I so sweaty?
Well, your body goes into sort of a reaction to dealing with pain, so go ahead and push out again. How's that?
Better.
Feel stronger?
Yeah.
Okay, tilt your right ear down towards your right shoulder. And then bring it back to center. And then again. And center. And again. And center. Good.
What is that?
It's your scaling muscle. So that attaches to that first rib that you were talking about.
Ow!
Okay, let's go both hands here and push out. How about there?
Feels better.
That feels more solid.
Yeah. It's sore here. Like if it, well, it feels like it's sore. I don't know. That yeah, where your thumb is at?
Mm-hmm. Like there.
Yeah. Oh yeah. It feels like I can't breathe when you touch that.
How about if I push there?
No,
No.
it's in the front.
Okay, makes sense. Push down towards my face. Okay, I'm gonna block right here. Push down towards my face again. That's stronger?
Yeah.
So you feel like it's right there?
Yeah.
Okay, so I'm gonna use an instrument and an instrument adjusting tool here to try to get that rib lined up.
Okay.
So we're gonna go right there. Sometimes people call me Van Helsing when I use this one.
Or
Is it like
Or-
it takes out vampires?
I was actually thinking of something less tough and like Fix It Felix.
Oh, that's cool too. Fix It Felix. Everybody always wonders, like, no, we like Wreck-It Ralph. I'm like, I like Fix It Felix better. I feel like he's a more integral character
Yeah.
to the storyline. But then again, I also prefer Gaston in the Beauty and the Beast too. So sometimes the hero they want is not the hero they need.
Yeah, oh my gosh, feels like I can breathe. Oh my gosh. Oh my gosh. That feels so good.
Good. Okay, let's check here again. Hand goes there, go ahead and push out.
Yeah, it
Feels
feels
stronger,
stronger.
right?
Yeah.
Alright, push down towards my face again. Not bad. Let's do a little more correction there. You can actually see where the soft tissue is pushing out too. So that rib's off as well. Feel that?
Yep. I feel like I'm... Oh. Oh my gosh.
Take a big deep breath now.
That's dope.
That's better. Okay, so I'm gonna do a little soft tissue work there too. Deep breath in. And blow it out. And in. And out. Good. And in. And out. Good. In. And out. One more time. There it goes. Good. Alright, check it again.
Wow.
That's better?
Yeah.
A lot better?
Yeah.
Good.
I'm literally tearing up.
So go hand here again and then push out. Dang.
That is so
That's way
dope.
stronger.
Oh my gosh.
Let's go here.
Fix
Push down.
it, Felix.
Push down. Yeah, not bad. Because if it's moving more, what I'm gonna have to do is teach you how to work on that on your own some. So people always ask, is popping bad? And I just think that it's important that if they are going to do it, they're not doing it too frequently and they're not doing it in ways that harm themselves.
Okay.
But inherently popping yourself isn't necessarily bad. I know a lot of chiropractors are like, oh no, never crack yourself.
Right.
It's just important to educate the patient if they're going to do it to not do something that puts them in harm's way.
Okay.
But if there's an easy way for somebody to be able to keep themselves healthy, that's what we want to teach people to
Right.
do.
Like I said, I'm constantly looking for relief. So all day I'm like pushing my shoulder
Twisting
blades
and
back.
turning.
I go like this and like this, constantly popping my neck. Sometimes I have my fiance pop my neck.
Yeah.
Yeah, I would love if you could teach me something to help keep it from constantly going back into place, because this feels friggin' great. I
Awesome.
seriously feel like I can breathe.
Good.
You know, they say like so there's an elephant sitting on my chest. That's literally what it felt like this entire time.
You know, I've had this myself. Unfortunately, a lot of doctors, if they've never gone through this, then they don't understand what you're talking about. I'm blessed and cursed in that way that I've been hurt enough times that I almost know what everybody's dealing with. So it's a blessing also, because when they say it, I'm not like these other doctors that think it's in your head or just want to throw pills at you or tell you have fibromyalgia or something like that.
Right.
There's a problem. We believe you, and we're going to get to the root of it.
Okay.
And that's really important. So let's try a couple push-ups.
Sure. Oh my gosh, easy peasy mac and cheesy. She's got food. Oh my gosh.
Boom.
So
That's what I like to
excited.
see.
Heck yeah. It's like I got WD-40 sprayed in there. Look at that. Look at this motion.
Oh man, you can sprinkler them, right? Boom. All right, go face up one more time.
Are you making a song?
No, I'm not doing that. All right, sit up again. You're dancing and gave it away, babe. Put your hand here. Push up. Yeah.
That's crazy.
Yeah. But what you want to do now is don't put pressure back here. Like no lacrosse ball, no adjusting, no popping here.
Okay.
So think about the ribs like a steering wheel. So if they're pushed out here, that means they're pushed in here. So every time you push here,
I'm pushing it forward.
exactly.
Oh,
and
that
that's gonna
makes
make it worse.
sense.
Even though I know it feels kind of like achy here.
Yeah,
you
it
feel
feels
like,
good to push it. I have one of those hook things,
Mhm.
and I pull it forward.
So the only thing
That
you would
makes
want to do is
sense.
push this one straight down,
Yeah.
but not necessarily forward this way.
Okay.
Because that's going to push this out, and then that's going to pinch the nerves, because the nerves go between the ribs there. And then that's going to turn off your arm. It's going to affect your breathing. And again, anytime you have chest stuff, everybody's going to assume that it's your heart.
Right, and that's exactly how I felt. I didn't know until I went to the ER that girls or females don't get the same symptoms as guys.
Well, and even that, just like worrying about your chest or your heart or your lungs, that's enough to give somebody anxiety anyway.
Right. And I think my mom made it worse. She's like, oh my God, you're having a heart attack, let's go.
Yeah, but it's going to do that
She
sometimes.
drove me.
You know, they're worried about the babies, right? The range feels good up top too?
Yeah. Well, it still does feel kind of stuck. Just a little bit. Like, it's still like struggling.
On the underside.
Yeah.
Okay. So let's clear that edge. So I'm going to hook
It's a bit
there.
shake. Ah!
Bring your elbow down.
Ah!
Bring it down, bring it down, bring it down.
I can't move.
Try to bring your elbow down. You can do it.
Ow!
Now raise the roof. Raise it up. Up,
You
up,
should have
up.
warned me. Oh my God.
Up, up, up. Up, 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 up. And down.
Ah!
Elbow down,
Oh
elbow
my
down.
God.
Throw them bows. And up again.
Ow!
Up, 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 up. All the way up. All
Oh
the way
my
up.
God.
And back down. 5.5 more.
Oh my gosh.
There. She's got a goal. She was ready for it. Down.
Ah!
Come on, 4.5 more. Let's go. 3.5 more. 2.5 more. 1.5 more. Just a half of one. Boom. All right, now let's check your range again.
Oh my gosh. Yeah, that feels way better. It's not even shaky.
There you
Before I was like struggling.
Right.
What the heck is
It's your
that?
latissimus dorsi.
Oh.
It's your lat.
Oh. Oh, okay. I know what that is.
Yeah, you got buff lats. So,
Cool.
but also because you're using the wrong muscles to hold your shoulder up because your ribs out,
Oh.
you've developed more lat and less pec and less shoulder. So now you've got a secondary muscle imbalance that was created as a byproduct of your joints and your bones. So that's why this is a two-layer issue. You can't just adjust the bones, you have to treat the muscles too. But you also can't ignore the bony structure either.
That hurt. Why is it so sensitive?
Muscles that are tight are smashed together, so there's more nerves all bunched together. So when you press on them, you activate more of them. Muscles that are loose, when you push on them, all those nerves that are in the muscle are more spread out, so they don't hurt as bad. So that's sort of how you know like what to roll out and what not to roll out. If you press on something and it doesn't really hurt, it doesn't need it. In fact, if it feels good, you really shouldn't do it.
Oh, okay. So is that why that tingling was? Is that why I feel it in my leg so much? That tingly sensation?
I think the leg thing is a different animal. I think the leg might be contributing upstream.
Oh,
I think
okay.
that's the leg length difference. So the question is why? Is it because you're twisting a certain way? Is it genetic? Are your muscles out of balance? So that's something we're going to have to sort of see as we go through a treatment plan, what helps and what doesn't. But based on these symptoms, I think 3 or 4 sessions, we should get you pretty much where we need to get you. And then the key at that point is for you to be able to take care of yourself. If your fiance, work on certain muscles if you need to. That way you don't have to spend all your money and your time, going out of network and seeing all these chiropractors and doctors and physical therapists.
Yeah.
The goal is self-reliance.
Okay. That makes sense. Yep. Thank you.
All right, you're very welcome.